One of the great things about all the healthcare conferences that we attend through Healthcare IT Today and Sway Health is getting the chance to meet so many interesting people and learning about so many interesting solutions. At the recent Health 2024 conference, I had the chance to meet with Klein. She is the Chief Technology Officer at Imagine Pediatrics. Here's my interview with her as she shares more about the work that they are doing. Let's get to it. Eden, welcome to the program.
Thank you so much for having me, Colin.
Now, I want to ask you some questions about what you're doing, but before we get there, can you give our audience just a quick little background of you and your role?
Yes, sure. All right. So I am an engineer by training. Started my career in tech about 25 years ago.
Okay.
And I've been part of startups that have evolved to be very successful companies in the e-commerce space, real estate, so companies like shopping.com, Trulia. And then about a little less than a decade ago is when I had the opportunity to move into healthcare, really being able to utilize the experience that I had in other industry into the healthcare's much needed space. That brought me into the mental health space, pediatric space, and now at Imagine Pediatrics, where we really do very important work. And that's where I find my passion.
And tell me a little bit more about Imagine Pediatrics. What are you guys doing there at that organization?
Yeah. So Imagine Pediatrics is a pediatrician-led medical group. We care for children with special healthcare needs. We currently care for 22,000 kids in 2 states. And what we do for them is we are there for them in any way that they need the healthcare space, whether it's medical health, behavioral health, social health. We provide the wraparound care. Our model is value-based care. And so we look at the child as a whole, which is a real gap today in healthcare, especially for the population that we care for, the underserved population, for these families that have very different types of needs. And so what we do is we don't replace their PCP, is we come along, we help the specialty providers, their PCPs. It's a virtual first model, and so we're there 24/7 for these patients. And anytime we are their anchor. So whenever they need us, instead of running to the emergency department, hospital, they contact us, and we serve them in plenty of ways. We have a platform, we have a mobile app where they can connect with us. But mostly our strength, I would say, is the data power that we have. And so what we built is the ability to understand their needs and be proactive with the care. So especially for these kids that have special health needs, there often isn't a solution for them. So whenever they have an acute need, sometimes they will call a doctor and they will get sent to the emergency department. Right? And so that's what we're trying to prevent. And we can be proactive and understand, okay, we're seeing the rising in risk in the immediate term or even in the longer term. How can we change that narrative for them? How can we keep them at home safe? I'll say this is some of the exciting work that we're doing with our clinical team, building the programs. So tech team working with the clinical team to say, how can we help these families in the way that they need it? And reaching out to them, hey, we see that you just discharged from the hospital. How can we help you stay at home? So the parents don't need to lose days at work. Sometimes for them, it means they need to lose their job.
Sure.
But rather stay at home and have the person and the clinical team that can follow them for acute needs, for longitudinal needs. So yeah, I get excited about this.
And so tell me a little bit more about the data. What are you doing with the data? How are you collecting it? What data are you collecting?
Yeah, that is again a superpower, is that we collect several different data sources. Some of them are claims data from our health plan partners. Some of them are real-time data. We get really an ecosystem of data that is between lab results, pharma, admission to the hospital, discharger when they transfer. Sometimes these families really need someone to hold their hand. They get discharged, they don't understand the care plan that they got. Maybe English is not their primary language, right? And so having that data, we have built a pretty sophisticated data analytics engine where we have predictions, again, about these patients are likely to go into a hospital in the next 30, 60, 90 days. How can we work with them to help prevent it, build their trust, and get them on a care plan? It's good. It's kind of a win-win situation. And the beauty of it, I would say, is not just tech for tech. Like, we really tailor our programs and our tech, working with our clinical team for these families. So they really are underserved. There isn't a lot of, luckily there's more recently, but there isn't a lot of investment into the pediatric space, especially for this more acute needs. So how do you bring tech and also to augment and support the clinical team, whether if it's the Imagine Pediatrics team, or even we have a very strong network engagement team that goes into the community, partners with the PCPs, foster families, and say, here's how we can support you, and work hand in hand with home nurses. And it's truly exceptional. It's a very unique model. We're seeing some outstanding results. So we already are seeing about 10% reduction of total cost of care, which is impressive.
Right.
And that is our goal, right? Our mission and our incentives are aligned with our health plan partners. We want to raise the bar, increase the quality for our patients and our families, and reduce the cost of care so that it's sustainable. And we're already seeing that type of success. So again, it's pretty unique in the industry.
And your partners, they are plans, right? That's who is.
We partner with health plans currently, and like, our model is kind of flexible in that way, because we have the ability to see the data and build custom programs for them. So currently health plans, in the future we're already looking at how can we increase, how can we touch more patients, more families, and impact them in this significant way.
Well, Eden, you've shared a lot of great information. Where can people go to learn more about Imagine Pediatrics?
Yeah, thank you for asking, Colin. So we have a website that is imaginepediatrics.org, and there's everything that there is there to help understand what we do.
So, Eden, thank you so much for coming on the program. It's been really great having you.
Yeah, it's been very special to be here. Thanks, Colin.
Just want to say thank you to Eden for hopping on camera with me and giving us that overview of Imagine Pediatrics. If you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com, where you will find more great content like this. I'm Colin Hung for Healthcare IT Today. Thanks for being here, and I'll catch you on the next video.